Hi, everybody. Nancy A. here from Professional Movement Solutions. Welcome to members of the Living Well Academy. Today, what I want to do for this video is share a little bit about balance and what's important in terms of our physical fitness for proper balance and safety. And I'm also going to take you through what's called a 30-second chair stand. And it's, as a PT, it's how we assess frequently our patients, whether they're in an outpatient setting or in the home. But it's a great way to assess if there might be any fall risk to consider as part of a treatment plan. So I'm going to take you through that today. Again, a 30-second chair stand. But I want to speak briefly about the components of safe mobility. And as a PT, it comes down to three things. One is range of motion. The second is strength. And the third being balance. Okay. So range of motion might look like this. So if we're walking, say I'm going to take a stride, right? Here's a step, kind of a snapshot of a step. My back ankle needs to move. I need to bring my body over my foot and shorten up this angle here between my shin and my foot. I need that range of motion to walk properly. Okay. I need to have a straight knee, not only in this part of the gait cycle, but as we land our heel, right? We need a straight knee, and I need some hip extension, the ability of this leg to go behind me to have a normal stride length, okay? So range of motion at the ankle, at the knees, and at the hips are important factors for our mobility and how safe we can be, okay? Second is strength. These big major muscle groups of our legs, our quads in the front of our thighs, the hamstrings behind our thighs, our glutes, buttock area, right? And arguably our calf muscles right back here, right? They serve to propel us forward as we walk and keep us stable. They help us to rise from a sitting position and sit back down under control and safely without a loss of balance, right? So we need these major muscle groups strong for safe mobility. And third is balance. It's your ability to keep your position and not change it unintendedly, right? And so if we are standing, but I've got a lot of sway, right? And then there's some reactions that come with that, that might be a compromise of balance. But if I can stand here and not sway at all, and I can look around and not sway, that is good balance. That is it uses three different body systems inherently inside of us to keep us stable, right? Even balance on one leg, that matters. That matters, right? Often physicians I'm hearing are actually asking someone to in a workup in a physician visit to stand on that one leg for 10 seconds just to see if you can do it. They're using that as a screen to see if there's any maybe changes, in your mobility and ability, but also to see if there's any fall risks that they need to address, right? So range of motion, strength, and balance. Now, strength and balance arguably are probably the two most important aspects of safe mobility and fall prevention, right? Range of motion, sometimes our gait may not be perfect, but if we're steady and we're strong, that's okay, right? I would prefer that. So strength and balance are critical. That's where the 30-second chair stand comes into play, because that is going to assess our strength and our balance, and I would argue endurance, because there's a time element to it. Over 30 seconds, right? The assessment is how many times can you stand and sit from a chair in 30 seconds? And there's scoring that goes along with that, and we'll go over that. We'll go over that after we're done here. Okay, so I'm going to use this chair to show this to you. And I've got a hard chair. I'm going to lower my camera just a little bit. I've got a hard chair with no wheels. And I actually, there's a credenza. There's a big piece of furniture behind it. I suggest you do that. If you want to try this, I suggest you have this chair backed up for your safety. Okay. But here's the thing. This test is not for everyone. No one test is good for everyone or appropriate for everyone. So this is not the test for you if you know you need your arms to stand up, because this will not have you using your arms, okay? So don't be discouraged. It just means there's another test that's more appropriate for you. Okay, so please don't do this if you need your arms to stand. It negates the score, quite frankly. It's a 0 score if that were to happen, if you were to use your arms. Okay, so this is about not using your arms and having your legs being able to have you stand completely and then sit back down. Okay, so we're going to time it. Time again is of the essence. We're going to see how many times you can come to a full stand with arms crossed and then come down and sit and repeat. Right? You're just going to keep repeating, trying to come to a full stand each time. But I need you to count. I need you to count how many times you do it. I'll run the clock for you. I'll give you a 3, 2, 1, go. Okay. And then you can repeat this. And then remember what your number is that you did in 30 seconds. And I'll give you a 3, 2, 1 stop at the end. Okay. So that's how it's going to go. Again, to demonstrate it, we're going to sit in the middle of the chair. Your feet are flat on the floor. Arms are crossed. And you're going to stand, come to a full stand, and then sit back down and repeat. Okay. And I need you to count. Need you to count that. Okay. So here we go. I'm going to, let me get my, my clock here. Got it right here. So again, it'll be a 3, 2, 1, go. So here we are. Let's get ready. So 3, 2, 1, go. Stand, fully stand, sit back down, keep going, be safe about it, but see how many you can do in the 30 seconds. Keep counting, know your number. Very good, about halfway there, about halfway there. Very good, keep counting, keep counting. Very good, so here comes the end here. So 3, 2, 1, stop. Okay, 30 seconds is done. What's your number? What's your number? Okay, and what I'm going to do here is I'm going to share my screen and I'm going to show you the numbers. Okay, all right. So 30-second chair stand. So this figure here, this chart gives you below average scores, and it goes by age. It goes by age, as you can see. So for example, say you're 60 to 64. If you're a male performing this, if you perform less than 14, 13 or less, sit to stands in this 30-second time frame, it can indicate a fall risk. Okay, the farther you are from that number, the more fall risk there is. So for example, 7, if you're able to do 7, is a higher fall risk than if you were able to do 12, which would be considered a low fall risk, right? And so there's the women, 60 to 64, less than 12. Again, this is a tried and true assessment, validated, standardized. We've been using it for years. Again, as I say in the PT world. So again, I'm going to ask you to take a minute and find your age and find the score. And if you want to even jot these down, but certainly remember your score and see where you fall. And see where you fall. Okay. And I ask you to let me know if you have any questions about it. Let me know. I'd love to know how you did on this assessment. And if you didn't get to do it, no worries. There are so many out there. I would suggest consulting with your physician or your therapist to see, or me, to see what other tests might be more appropriate for you and your health status. It's all good. None of them are good for everyone. It just doesn't work that way. Okay. So I'm going to go ahead and stop sharing this. All right. Very good. All right. So that is the 30-second chair stand assessment that, again, we use in the physical therapy world quite frequently. But it's kind of a neat thing that you can do on your own. And again, it's strength, balance, and even endurance. Those are the components that this test really does assess. Okay. So thank you. All right. Let me know how you scored and how it's going for you. Okay. And be safe out there. Keep moving. Thank you.